Question 1. The investigation demonstrates a medical scribe documenting a patient's report of feeling like a truck hit me as a vital sign measurement in the objective section of the SOAP note. Which of the following approaches best reflects accurate and professional documentation practices for a medical scribe? Option A. Documenting the patient's statement verbatim within the subjective section, clearly indicating it is the patient's reported sensation. Option B. Omitting the patient's statement entirely from the SOAP note due to its subjective nature. Option C. Including the phrase patient reports feeling like a truck hit them within the objective section as a description of the patient's demeanor. Option D. Recording patient states severe pain in the objective section without further qualification. The correct answer is A. Documenting the patient's statement verbatim within the subjective section, clearly indicating it is the patient's reported sensation. Explanation. The investigation demonstrates a common challenge in medical documentation, ensuring the SOAP note accurately reflects the patient encounter while adhering to professional standards and regulatory requirements for medical scribes. The core challenge lies in distinguishing between subjective patient reports and objective clinical findings, and then accurately synthesizing these into a coherent assessment and plan. Misclassification can lead to incomplete or inaccurate patient records, potentially impacting patient care, billing, and legal compliance. The correct approach represents best professional practice because it meticulously separates subjective information, what the patient reports, from objective data, what the clinician observes or measures. This adherence to the fundamental structure of a SOAP note ensures clarity, accuracy, and completeness. It directly supports the physician's diagnostic process and treatment planning by providing a well-organized and reliable record. This aligns with the implicit regulatory expectation of accurate and truthful medical record keeping, which is paramount for patient safety and legal integrity. An incorrect approach that conflates subjective statements with objective findings is professionally unacceptable. This failure represents a breach of professional integrity and potentially violates regulations concerning the accuracy and completeness of medical records. For instance, presenting a patient's self-reported pain level as an objective finding without attributing it to the patient's statement misrepresents the data and can mislead subsequent healthcare providers. Similarly, including speculative or unconfirmed information in the objective section, without clear indication of its source or verification, undermines the reliability of the medical record. Such inaccuracies can lead to diagnostic errors, inappropriate treatment, and potential legal ramifications for both the scribe and the supervising physician. The professional reasoning process for similar situations should involve a constant internal check. Is this information directly observed or measured by the clinician, or is it reported by the patient? If it's reported by the patient, it belongs in the subjective section. If it's observed or measured, it belongs in the objective section. The assessment synthesizes both, and the plan outlines the next steps. This systematic evaluation ensures that each piece of information is placed in its correct context, maintaining the integrity and utility of the medical record. Question 2. Upon reviewing the patient's chart, a scribe encounters the abbreviation SOB in the physician's notes. The scribe is unsure if this refers to shortness of breath or son of a bitch, a colloquialism sometimes used in informal settings. The physician is currently with another patient and unavailable for immediate clarification. What is the most appropriate course of action for the scribe? Option A. Document SOB as written, assuming it refers to shortness of breath given the medical context. Option B. Document SOB as written and add a note indicating the ambiguity. Option C. Seek immediate clarification from the supervising physician regarding the intended meaning of SOB before documenting it. Option D. Consult a general medical abbreviation dictionary to determine the most common meaning of SOB and document that. Correct answer is C. Seek immediate clarification from the supervising physician regarding the intended meaning of SOB before documenting it. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of medical documentation and the potential for misinterpretation of abbreviations. Inaccurate or ambiguous abbreviations can lead to serious patient safety issues, including incorrect diagnosis, medication errors, or delayed treatment. The scribe's responsibility is to ensure clarity and accuracy in all recorded information, adhering to established standards and institutional policies. Correct approach analysis. The correct approach involves seeking clarification from the supervising physician regarding the ambiguous abbreviation. This upholds the principle of patient safety by ensuring the accuracy and completeness of the medical record. It demonstrates professional integrity and adherence to the ethical obligation to provide precise documentation. This aligns with the core tenets of medical scribe certification, which emphasize accuracy, attention to detail, and effective communication within the healthcare team. Incorrect approaches analysis, failing to seek clarification, and instead making an assumption about the abbreviation's meaning is a direct violation of the scribe's duty to ensure accuracy. This assumption could lead to the recording of incorrect information, potentially compromising patient care and violating the trust placed in the scribe. It also bypasses the established chain of command for resolving documentation ambiguities. Documenting the abbreviation as is, without clarification, perpetuates ambiguity. While it might seem like a neutral action, it leaves the interpretation to others who may not have the same context as the scribe or the supervising physician, increasing the risk of misinterpretation and subsequent errors. This approach neglects the scribe's proactive role in ensuring the clarity of the medical record. Consulting a colleague or a general medical dictionary for interpretation without direct physician confirmation is also problematic. While these resources can be helpful, they do not replace the specific context and intent of the supervising physician. The physician's interpretation is paramount, and relying on external, generalized sources can introduce new inaccuracies or misinterpretations specific to the patient's situation. Professional reasoning. Professionals facing such a situation should employ a systematic approach. First, identify the ambiguity or potential for misinterpretation. Second, recognize the importance of accuracy and patient safety in medical documentation. Third, consult the primary source of information, the supervising physician, for clarification. Fourth, document the clarified information accurately and completely. If direct clarification is not immediately possible, the scribe should note the ambiguity and flag it for follow-up, rather than proceeding with an assumption or incomplete information. Question 3. Risk assessment procedures indicate that a patient presents with a rash on their left forearm. The physician observes redness, swelling, and a small, non-purulent vesicle. The physician dictates erythema and mild edema noted on the left forearm with a single clear bleb present. Which of the following best reflects the scribe's documentation of this integumentary finding? Option A. Erythema and mild edema of the left forearm with a single clear bleb. Option B. Patient has a red, swollen rash with a blister on their left arm. Option C. Left forearm is very red and puffy with a small blister. Option D. Suspected contact dermatitis on the left forearm due to redness and swelling. The correct answer is A. Erythema and mild edema of the left forearm with a single clear bleb. Explanation. This scenario is professionally challenging because it requires the scribe to balance the immediate need for accurate documentation with the potential for misinterpretation or overreach in describing a patient's condition. The integumentary system, while outwardly visible, can present with subtle findings that require precise and objective language. The scribe must avoid making diagnostic assumptions or using subjective descriptors that could mislead the clinician. The correct approach represents best professional practice because it focuses on objective, observable findings and uses precise medical terminology. This aligns with the core responsibilities of a medical scribe, to accurately record the physician's observations and dictations without adding personal interpretation or diagnosis. Adhering to this principle ensures that the patient's medical record is a faithful and objective representation of the clinical encounter, which is crucial for continuity of care, legal defensibility, and accurate billing. This approach upholds the ethical duty of fidelity to the physician's findings and the integrity of the medical record. An incorrect approach that involves using vague or subjective descriptors like looks bad or seems infected fails to meet the standard of objective documentation. This can lead to miscommunication between healthcare providers, potentially impacting patient care. Ethically, it represents a failure to accurately and objectively record clinical information. Another incorrect approach, such as attempting to diagnose the condition, e.g., suspected cellulitis, constitutes practicing medicine without a license, a serious regulatory and ethical violation. Scribes are not authorized to make diagnoses. A third incorrect approach, focusing solely on the patient's subjective complaint without detailing objective findings, e.g., patient complains of itchy rash. is incomplete documentation. While the patient's complaint is important, the scribe's role is to document the physician's objective assessment of that complaint. Professional decision-making process for similar situations involves a constant self-check. Am I recording what I see and hear, or am I interpreting or diagnosing? Scribes should always default to objective, descriptive language and defer any diagnostic or treatment-related decisions to the licensed clinician. When in doubt about the appropriate terminology or the scope of their documentation, scribes should seek clarification from the supervising physician. Question 4. Examination of the data shows a medical scribe encountering the term nephrolithiasis in a patient's chart. The scribe needs to accurately document this condition, which breakdown of the term's components and their meanings would lead to the most precise understanding for accurate documentation. Option A. Root word nephr meaning kidney, prefix lith meaning small and suffix iasis meaning disease. Option B. Root word nephr meaning kidney, prefix lith meaning stone and suffix iasis meaning condition or presence of. Option C. Root word nephr meaning urine, prefix lith meaning stone and suffix iasis meaning surgical procedure. Option D. Root word nephro meaning kidney, prefix litho meaning stone and suffix iasis meaning inflammation. The correct answer is B. Root word nephr meaning kidney, prefix lith meaning stone and suffix iasis meaning condition or presence of. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical scribe to accurately interpret and document patient information based on their understanding of medical terminology. Misinterpreting or incorrectly applying prefixes, suffixes, and root words can lead to significant documentation errors, potentially impacting patient care, billing, and legal records. The scribe must demonstrate a strong foundational knowledge of medical etymology to ensure precision. Correct approach analysis. The correct approach involves identifying the root word, understanding the meaning of the prefix, and then interpreting the suffix to accurately define the medical term. This systematic breakdown ensures that the scribe grasps the full meaning of the term as it relates to the patient's condition or procedure. Example: understanding cardi, heart, itis, inflammation, and peri, around, allows for the correct interpretation of pericarditis as inflammation around the heart. This aligns with the MSCAT emphasis on accurate medical documentation and understanding of medical terminology, which is a core competency for certified scribes. Incorrect approaches analysis. One incorrect approach is to guess the meaning based on a partial understanding of a word component. For instance, if a scribe only recognizes itis as inflammation but doesn't understand the root word, they might incorrectly apply the term to a different organ system. This represents a failure to adhere to the MSCAT requirement for precise medical terminology comprehension, leading to inaccurate documentation. Another incorrect approach is to rely solely on memorization of common terms without understanding the underlying etymological structure. Memorization can be helpful. It doesn't equip the scribe to decipher unfamiliar terms or variations. This approach fails to demonstrate the deep analytical skill in word construction that the MSCAT aims to assess, potentially leading to errors when encountering less common medical terms. A third incorrect approach is to assume a prefix or suffix has a universal meaning across all medical contexts, ignoring nuances or exceptions. Medical language can be complex, and the same component might carry slightly different implications depending on the root word or clinical situation. This demonstrates a lack of critical thinking and a superficial understanding, which is a direct contravention of the MSCAT objective to produce competent and knowledgeable medical scribes. Professional reasoning. Professionals should approach medical terminology by first identifying the root word, which forms the core meaning of the term. Then they should analyze any prefixes, which typically modify the meaning of the root word by indicating location, time, number, or status. Finally, they should examine suffixes, which often describe a condition, disease, procedure, or part of speech. This structured approach ensures a comprehensive and accurate understanding of the medical term, minimizing the risk of documentation errors and upholding professional standards of care. Question 5. Performance analysis shows a patient presenting with gastrointestinal complaints. The physician asks the scribe to document the patient's reported symptoms. The patient states, "My tummy feels all crampy and bloated and I feel a bit sick to my stomach." The physician observes mild abdominal distension. Which of the following best represent the appropriate documentation for the scribe? Option A. Patient reports nausea. Physician notes mild abdominal distension. Option B. Patient reports intermittent abdominal cramping and bloating with occasional nausea. Physician notes mild abdominal distension. Option C. Patient reports intermittent abdominal cramping and bloating with occasional nausea. Physician notes patient likely has indigestion. Option D. Patient reports stomach feels upset and gassy. Physician notes mild abdominal distension. Correct answer is B. Patient reports intermittent abdominal cramping and bloating with occasional nausea. Physician notes mild abdominal distension. Explanation. Scenario analysis. This scenario presents a common challenge for medical scribes, accurately documenting patient information while ensuring patient privacy and adhering to established medical protocols. The challenge lies in discerning the appropriate level of detail and the correct terminology to use when describing a patient's gastrointestinal symptoms, particularly when the patient is experiencing discomfort and may not be able to articulate their symptoms precisely. The scribe must balance the need for comprehensive documentation with the ethical obligation to avoid misinterpretation or the inclusion of unnecessary or speculative information. Correct approach analysis. The correct approach involves using precise, objective medical terminology to describe the patient's reported symptoms and the physician's observations. This aligns with the core principles of medical documentation, which emphasize accuracy, clarity, and completeness. By documenting patient reports intermittent abdominal cramping and bloating with occasional nausea, the scribe provides a factual account of the patient's subjective experience and the physician's objective findings. This level of detail is sufficient for medical records and allows for accurate diagnosis and treatment planning without introducing ambiguity or speculation. This approach adheres to the MSCAT guidelines for accurate and professional medical record keeping. Incorrect approaches analysis. One incorrect approach involves using vague or colloquial language, such as stomach feels upset and gassy. This lacks the precision required for medical documentation, making it difficult for other healthcare professionals to understand the exact nature of the symptoms. It fails to meet the standards of professional medical record keeping and could lead to misdiagnosis or inappropriate treatment. Another incorrect approach is to include speculative or diagnostic interpretations, such as patient likely has indigestion. Medical scribes are not authorized to make diagnoses. This type of documentation oversteps the scribe's role and could introduce bias into the medical record, potentially influencing the physician's independent judgment. This violates the principle of objective documentation and the defined scope of practice for a medical scribe. A third incorrect approach is to omit relevant details, such as only documenting patient reports nausea. While nausea is a symptom, omitting the associated abdominal cramping and bloating provides an incomplete picture of the patient's gastrointestinal distress. Incomplete documentation can hinder effective patient care and may not meet regulatory requirements for thorough medical records. Professional reasoning. Professionals should employ a decision-making framework that prioritizes accuracy, objectivity, and adherence to scope of practice. When faced with patient symptoms, the scribe should focus on capturing the patient's reported sensations and the physician's observed signs using established medical terminology. If unsure about the precise term, the scribe should consult with the supervising physician. The scribe's role is to be an accurate recorder, not an interpreter or diagnostician. This systematic approach ensures that the medical record is a reliable tool for patient care and complies with all relevant professional and regulatory standards. Question 6. The performance metrics show a recurring pattern of the scribe documenting terms related to cardiology with a degree of ambiguity, potentially leading to misinterpretation by other members of the cardiology team. The supervising physician has noted several instances where the scribe's documentation of cardiac conditions and procedures could be more precise, using terminology specific to the subspecialty. Option A. The scribe should use more general medical terms that are commonly understood across different specialties to ensure broader comprehension of the patient's condition. Option B. The scribe should infer the meaning of unfamiliar cardiology terms based on the general context of the patient's visit and document what they believe is most likely correct. Option C. The scribe should avoid documenting any cardiology-specific terms and instead focus on general patient complaints to prevent potential errors. Option D. The scribe should proactively consult cardiology-specific medical dictionaries and glossaries to familiarize themselves with the precise terminology used in the specialty and seek clarification from the supervising physician. When any term is unclear or its application in context is uncertain. The correct answer is D. The scribe should proactively consult cardiology-specific medical dictionaries and glossaries to familiarize themselves with the precise terminology used in the specialty and seek clarification from the supervising physician when any term is unclear or its application in context is uncertain. Explanation. This scenario presents a professional challenge due to the critical need for accurate and precise medical documentation, especially when dealing with specialized medical terminology. Misinterpreting or incorrectly documenting terms can lead to significant patient safety risks, misdiagnosis, inappropriate treatment, and potential legal ramifications. The scribe's role is to be a conduit for accurate information transfer, and a failure in this regard undermines the entire healthcare process. Careful judgment is required to ensure that all medical terms are understood in their proper context and documented according to established medical conventions and the specific requirements of the specialty. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance. By actively seeking clarification and confirming understanding of specialized terminology, the scribe ensures the integrity of the medical record. This aligns with the core principles of medical documentation, which demand accuracy, completeness, and clarity. Adhering to the established terminology of the medical specialty is paramount, as it ensures that other healthcare professionals can interpret the record correctly. This proactive approach also demonstrates a commitment to continuous learning and professional development, essential for a medical scribe. An incorrect approach that involves guessing or assuming the meaning of unfamiliar terminology is a direct violation of professional ethics and potentially regulatory guidelines concerning accurate record keeping. This failure to verify can lead to the creation of an inaccurate medical record, which is a serious breach of trust and a risk to patient care. Another incorrect approach, such as using generic or simplified terms instead of precise medical terminology, also compromises the integrity of the record. Medical specialties rely on specific language for precise communication. Substituting general terms can obscure critical diagnostic or treatment information, leading to potential misinterpretations by other clinicians. This demonstrates a lack of diligence and an insufficient understanding of the scribe's responsibilities. The professional reasoning process for similar situations should involve a systematic approach to information gathering and verification. When encountering unfamiliar medical terminology, the scribe should first attempt to understand the context in which the term is used. If clarity is not achieved, the immediate next step should be to consult reliable resources, such as medical dictionaries, specialty-specific glossaries, or established clinical guidelines. If still uncertain, the most professional and safest course of action is to politely and respectfully seek clarification from the supervising physician or other qualified healthcare professional. This iterative process of understanding, verifying, and clarifying ensures that the medical record remains accurate and reliable. Question 7. Analysis of a physician dictating a patient's chief complaint as dyspnea on exertion with occasional pleuritic chest pain exacerbated by supine positioning. The scribe encounters the term dyspnea and is unsure of its precise meaning in this context, though they have a general idea. Which of the following actions best demonstrates adherence to professional standards for a medical scribe? Option A. The scribe accurately transcribes dyspnea on exertion as dictated, relying on their general understanding of the term. Option B. The scribe omits the term dyspnea from the chief complaint to avoid potential inaccuracies. Option C. The scribe substitutes shortness of breath for dyspnea as they believe it is a more common and understandable term. Option D. The scribe pauses the dictation and asks the physician for clarification on the term dyspnea to ensure accurate documentation. The correct answer is A. The scribe accurately transcribes dyspnea on exertion as dictated, relying on their general understanding of the term. Explanation. This scenario presents a professional challenge due to the critical nature of accurate medical terminology in patient care documentation. Misinterpreting or incorrectly transcribing medical terms can lead to diagnostic errors, inappropriate treatment, and patient harm, all of which have significant implications for patient safety and regulatory compliance within the U.S. healthcare system. The Medical Scribe Certification and Aptitude Test, MSCAT, emphasizes the importance of precise medical terminology as a foundational skill for scribes. The correct approach represents best professional practice because it prioritizes accuracy and clarity in medical documentation, directly aligning with the U.S. healthcare regulatory framework, particularly the Health Insurance Portability and Accountability Act, HIPAA, which mandates accurate and complete patient records. It also adheres to the ethical obligation of a scribe to support the physician in providing high-quality care. By seeking clarification, the scribe demonstrates diligence, a commitment to understanding, and a proactive approach to preventing errors, thereby upholding professional standards and ensuring the integrity of the medical record. An incorrect approach that involves guessing or assuming the meaning of an unfamiliar term is professionally unacceptable. This constitutes a failure to adhere to the principle of accuracy in documentation, potentially leading to the creation of a false or misleading medical record. Such an action violates the ethical duty to the patient and the supervising physician, and could be seen as a breach of the scribe's responsibilities under general healthcare practice guidelines that emphasize diligence and competence. Another incorrect approach, such as omitting the term entirely, also fails to meet professional standards. While it avoids introducing an incorrect term, it leaves a gap in the patient's record, hindering a complete understanding of the physician's assessment or plan. This omission can impede subsequent care and may be considered a failure to fulfill the scribe's role in comprehensive documentation. The professional reasoning process for similar situations should involve a systematic approach. First, attempt to identify the term based on context and common medical knowledge. If uncertainty persists, the immediate and most appropriate action is to seek clarification from the supervising physician or clinician. This ensures that the medical record accurately reflects the clinical encounter and avoids the introduction of errors or omissions that could compromise patient care and regulatory compliance. Question 8. Quality control measures reveal that a new medical scribe is struggling to accurately document patient conditions involving both shortness of breath and chest pain. To improve their understanding and charting accuracy, which comparative analysis of human body systems would best enhance their ability to capture the interconnectedness of these symptoms in a medical record. Option A. Comparing the cardiovascular system's role in blood circulation with the respiratory system's function in gas exchange. Option B. Analyzing the digestive system's breakdown of nutrients and the excretory system's waste removal processes. Option C. Examining the skeletal system's structural support and the muscular system's movement capabilities. Option D. Investigating the nervous system's signal transmission and the endocrine system's hormone regulation. Correct answer is A. Comparing the cardiovascular system's role in blood circulation with the respiratory system's function in gas exchange. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical scribe to accurately document patient information across multiple, interconnected human body systems. Misunderstanding the relationships between these systems can lead to incomplete or inaccurate charting, potentially impacting patient care and diagnostic accuracy. The scribe must demonstrate a foundational understanding of how different systems function and interact to provide a comprehensive and clinically relevant record. Correct approach analysis. The correct approach involves a comparative analysis of the cardiovascular and respiratory systems, focusing on their interdependence. This is best professional practice because these two systems are intrinsically linked. The cardiovascular system circulates oxygenated blood from the lungs, respiratory system, to the rest of the body and returns deoxygenated blood to the lungs for oxygenation. Understanding this relationship is crucial for documenting conditions that affect both, such as pneumonia, pulmonary embolism, or heart failure, where symptoms and treatments often involve both systems. This aligns with the MSCAT objective of assessing a scribe's ability to capture clinically significant patient data accurately and comprehensively, reflecting a deep understanding of human physiology relevant to medical documentation. Incorrect approaches analysis. One incorrect approach would be to focus solely on the digestive system. This is a regulatory and ethical failure, because it demonstrates a lack of understanding of the immediate physiological context of common patient presentations that often involve cardiopulmonary issues. It fails to capture essential information related to oxygenation and circulation, which are fundamental to patient assessment and documentation. Another incorrect approach would be to compare the skeletal system with the integumentary system. While both are distinct body systems, their direct, immediate interdependence in the context of acute patient charting is less pronounced than that of the cardiovascular and respiratory systems. Focusing on this comparison would represent a failure to prioritize the most clinically relevant physiological connections for accurate and efficient medical record keeping, potentially leading to the omission of critical cardiopulmonary data. Professional reasoning. Professionals should approach this by first identifying the core task: accurate and comprehensive medical documentation. This requires understanding which body systems are most frequently and critically interconnected in a clinical setting. A decision-making process would involve 1. Identifying the primary systems involved in a patient's chief complaint or presenting symptoms. 2. Understanding the functional relationship between those systems. And 3. Selecting the comparative analysis that best reflects this clinical interdependence to ensure accurate and relevant charting. This prioritizes clinical relevance and physiological accuracy, directly supporting patient safety and effective communication within the healthcare team. Question 9. Compliance review shows a physician dictating a new prescription for patient experiencing severe nausea and vomiting, stating, "Prescribe ondansetron 4 mg Roman 4 to manage the emesis." The scribe is unsure if emesis refers to the symptom itself or the act of vomiting. Which of the following actions best demonstrates adherence to pharmacological terminology standards and professional scribing practice? Option A. Documenting ondansetron 4 mg Roman 4 for nausea and vomiting to ensure clarity. Option B. Documenting ondansetron 4 mg Roman 4 to manage the emesis, and then immediately seeking clarification from the physician regarding the precise meaning of emesis in this context. Option C. Documenting ondansetron 4 mg Roman 4 to manage the emesis as dictated, assuming the physician's intent is understood. Option D. Documenting ondansetron 4 mg Roman 4 to manage the act of vomiting, to be more specific about the symptom. Correct answer is A. Documenting ondansetron 4 mg Roman 4 for nausea and vomiting to ensure clarity. Explanation. This scenario presents a professional challenge due to the critical nature of accurate pharmacological terminology in medical documentation. Misinterpreting or misusing terms can lead to medication errors, patient harm, and regulatory noncompliance. The medical scribe's role is to accurately capture physician dictation, and this requires a precise understanding of pharmacological concepts. The correct approach represents best professional practice because it prioritizes patient safety and regulatory adherence. By correctly identifying and documenting the intended pharmacological action of a prescribed medication, the scribe ensures that the medical record accurately reflects the physician's orders. This precision is vital for subsequent healthcare providers to understand the treatment plan, avoid contraindications, and manage potential adverse drug reactions. The MSCAT emphasis on accurate documentation, including pharmacological terms, aligns with the overarching goal of maintaining high standards in medical scribing. An incorrect approach that involves guessing or assuming the meaning of a pharmacological term is a significant regulatory and ethical failure. It directly compromises the integrity of the medical record, which is a legal document. This failure can lead to patient harm if the incorrect term leads to a misunderstanding of the medication's purpose or administration. Ethically, it violates the scribe's duty to provide accurate and reliable documentation. Furthermore, it demonstrates a lack of competence in a core area of scribing, potentially violating guidelines set forth by the MSCAT for certified scribes. Another incorrect approach, such as using a generic term when a specific pharmacological class is indicated, also represents a failure. While not as immediately dangerous as outright misinterpretation, it reduces the clarity and specificity of the record. This can hinder efficient communication among healthcare providers and may lead to delays in identifying appropriate treatment alternatives or managing complex medication regimens. It falls short of the detailed and precise documentation expected of a certified medical scribe. The professional decision-making process for similar situations should involve a commitment to accuracy and a proactive approach to clarifying any ambiguity. When encountering an unfamiliar or unclear pharmacological term, the scribe should not proceed with an assumption. Instead, the best practice is to immediately seek clarification from the supervising physician. This ensures that the documentation is precise and reflects the physician's intent. This process upholds the scribe's responsibility to accuracy, patient safety, and adherence to professional standards. Question 10. Research into optimizing the process of completing a history and physical H&P documentation for a new patient encounter. What approach best aligns with the principles of accurate, complete, and compliant medical record keeping, as expected for the medical scribe certification and aptitude test, MSCAT? Option A. Rely primarily on voice recognition software to transcribe the physician's dictation, with only a cursory review to catch obvious errors, prioritizing speed of completion. Option B. Systematically capture the physician's dictation and observations in real time, ensuring all components of the H&P are addressed according to established MSCAT guidelines, and then conduct a thorough review for accuracy and completeness before submission. Option C. Focus on documenting only the most critical symptoms and findings mentioned by the physician, omitting less prominent details to expedite the H&P creation process. Option D. Pre-populate sections of the H&P with information from the patient's previous electronic health record, assuming continuity of care without direct physician confirmation of current status. The correct answer is B. Systematically capture the physician's dictation and observations in real time, ensuring all components of the H&P are addressed according to established MSCAT guidelines, and then conduct a thorough review for accuracy and completeness before submission. Explanation. This scenario presents a common challenge in medical documentation, balancing efficiency with accuracy and completeness in the H&P. The professional challenge lies in optimizing the scribe's workflow without compromising the integrity of the patient record, which has direct implications for patient care, billing, and legal compliance. Careful judgment is required to identify methods that enhance productivity without introducing errors or omitting critical information. The correct approach represents best professional practice because it prioritizes the systematic and accurate capture of patient information directly from the physician's interaction. This ensures that the H&P reflects the physician's findings and thought process in real time, minimizing the risk of misinterpretation or omission. Adhering to established protocols for H&P documentation, as likely outlined in MSCAT guidelines, ensures consistency and compliance with standards for medical records. This approach directly supports the physician's ability to provide informed care and facilitates accurate communication among the healthcare team. An incorrect approach that involves pre-filling sections of the H&P based on previous encounters without direct physician input or verification is professionally unacceptable. This violates the principle of accurate and contemporaneous documentation. Such a practice could lead to the inclusion of outdated or irrelevant information, or worse, the omission of new or changed patient conditions, directly impacting patient safety and potentially leading to diagnostic or treatment errors. This also raises ethical concerns regarding the integrity of the medical record and could have legal ramifications if the documentation is found to be inaccurate or misleading. Another incorrect approach, such as relying solely on voice recognition software without thorough review and correction by the scribe, introduces a significant risk of transcription errors. Voice recognition technology, while useful, is not infallible and can misinterpret medical terminology, patient statements, or physician dictation. Failure to meticulously review and edit the output means the H&P may contain inaccuracies that are not attributable to the physician's direct observation or dictation, compromising the reliability of the medical record. This also fails to meet the scribe's responsibility to ensure the accuracy of the documentation. A third incorrect approach, focusing on speed over thoroughness by only documenting the most salient points of the H&P, is also professionally unacceptable. The H&P is a comprehensive record of the patient's condition at a specific point in time. Omitting details, even if seemingly minor, can deprive other healthcare providers of crucial context for decision-making. This approach undermines the purpose of the H&P as a complete and detailed account, potentially leading to fragmented care and increased risk to the patient. The professional decision-making process for similar situations should involve a constant evaluation of workflow against the core principles of medical documentation: accuracy, completeness, timeliness, and compliance. Scribes should always prioritize capturing information directly from the physician and verifying its accuracy. When seeking to optimize processes, the focus should be on methods that enhance the scribe's ability to efficiently and accurately record the physician's input, rather than shortcuts that compromise the integrity of the medical record. This includes understanding and adhering to the specific guidelines and best practices mandated by the MSCAT. Question 11. Compliance review shows a research coordinator from an affiliated university has requested access to de-identified patient chart notes for a study on treatment outcomes. The request is direct and bypasses the standard Institutional Review Board approval process. The scribe is aware that the patient's name and specific identifiers are not included in the notes provided. The detailed clinical context could potentially allow for re-identification if cross-referenced with other available data. What is the most appropriate course of action for the medical scribe? Option A. Forward the request to the supervising physician and ask them to approve the release of the notes, as the physician has the ultimate authority over patient records. Option B. Provide the requested chart notes directly to the research coordinator, assuming that since the explicit identifiers are removed, the information is sufficiently de-identified. Option C. Attempt to de-identify the notes further by removing more clinical details, even if it compromises the completeness of the documentation, to satisfy the research coordinator's request. Option D. Politely decline the request, explaining that all data sharing must follow the established institutional protocols, including obtaining necessary IRB approvals and ensuring proper de-identification procedures are followed before any information is released. The correct answer is D. Politely decline the request, explaining that all data sharing must follow the established institutional protocols, including obtaining necessary IRB approvals and ensuring proper de-identification procedures are followed before any information is released. Explanation. This scenario is professionally challenging because it requires a scribe to balance the immediate need for accurate patient care documentation with the strict adherence to regulatory requirements and ethical principles governing medical records. The scribe's role is to facilitate efficient and accurate documentation, but this must never compromise patient privacy or the integrity of the medical record. The correct approach represents best professional practice because it prioritizes patient confidentiality and data integrity, which are fundamental tenets of medical record keeping. By seeking clarification and adhering to established protocols for handling sensitive information, the scribe upholds the trust placed in them by both the patient and the healthcare institution. This aligns with the principles of the Health Insurance Portability and Accountability Act, HIPAA, in the U.S., which mandates the protection of protected health information (FI). Specifically, unauthorized disclosure or access to PHI is a direct violation. An incorrect approach that involves directly sharing patient information with an unauthorized external entity, even if seemingly for a legitimate research purpose without proper anonymization or consent, represents a significant regulatory and ethical failure. This would constitute a breach of patient privacy and a violation of HIPAA privacy rule. Another incorrect approach, such as fabricating or altering documentation to fit a perceived need, is a direct violation of the integrity of the medical record and can lead to serious patient safety issues and legal repercussions, including potential fraud. A third incorrect approach, ignoring the request due to uncertainty without seeking guidance, could lead to missed opportunities for legitimate research or data collection, but more critically, it fails to address a potential compliance gap proactively. Professional decision-making in such situations requires a clear understanding of the scribe's scope of practice, institutional policies, and relevant regulations. When faced with ambiguity or a request that seems to skirt established protocols, the professional scribe should always err on the side of caution, seek clarification from their supervising physician or designated compliance officer, and ensure all actions are documented and compliant with privacy and data security laws. Question 12. Cost-benefit analysis shows that implementing advanced automated vital sign monitoring systems can significantly reduce the time spent by medical scribes on manual data entry, but it also introduces a risk of overlooking subtle patient distress indicators not captured by the technology. In this scenario, what is the most appropriate course of action for a certified medical scribe? Option A. Document only the vital signs provided by the automated system and disregard any other observations or patient complaints not directly inputted into the system. Option B. Supplement the automated vital sign data with direct observation of the patient's demeanor, respiratory effort, and any verbalized discomfort, and cross-reference these observations with the physician's assessment to ensure a complete and accurate record. Option C. Rely exclusively on the automated vital sign monitoring system for data entry, assuming its accuracy and completeness for all aspects of the patient encounter. Option D. Prioritize the speed of data entry by accepting all automated vital sign readings without further verification, even if subtle patient distress is observed. The correct answer is B. Supplement the automated vital sign data with direct observation of the patient's demeanor, respiratory effort, and any verbalized discomfort, and cross-reference these observations with the physician's assessment to ensure a complete and accurate record. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a medical scribe to balance the immediate need for accurate patient documentation with the potential for over-reliance on technology, which may not fully capture nuanced clinical observations. The scribe must exercise judgment in determining when to supplement automated data with direct patient interaction and physician observation, ensuring the integrity and completeness of the medical record. Correct approach analysis. The correct approach represents best professional practice because it prioritizes comprehensive and accurate patient care documentation. By verifying automated data against direct observation and physician input, the scribe ensures that the medical record reflects the full clinical picture, including subtle signs and symptoms that automated systems might miss. This aligns with the core ethical and regulatory principles of medical documentation, emphasizing truthfulness, accuracy, and completeness to support patient safety and continuity of care. The MSCAT framework emphasizes the scribe's role in augmenting, not replacing, clinical judgment and direct patient assessment. Incorrect approaches analysis. One incorrect approach involves solely relying on automated data without verification. This is professionally unacceptable because it risks creating an incomplete or inaccurate medical record. Regulatory guidelines for medical documentation, as implicitly understood within the MSCAT framework, mandate that records be a true and accurate reflection of the patient encounter. Failure to verify can lead to misdiagnosis, inappropriate treatment, and potential legal ramifications. Ethically, it breaches the duty of care by not ensuring the highest quality of information is available for clinical decision-making. Another incorrect approach is to prioritize speed of documentation over accuracy by accepting automated data without critical review. This is a failure to uphold professional standards. The MSCAT exam assesses a scribe's ability to produce high-quality documentation, which inherently requires diligence and attention to detail. Overlooking discrepancies or potential errors due to a desire for efficiency undermines the fundamental purpose of medical record-keeping. This can lead to patient harm and violates the implicit trust placed in medical professionals to maintain accurate records. A third incorrect approach is to document only what the automated system captures, ignoring verbal cues or physical findings not directly inputted. This is a significant professional failing. Medical scribes are trained to observe and record the entirety of the patient encounter, including the physician's physical examination findings, patient responses, and any nonverbal communication. Relying solely on automated inputs limits the scope of documentation, potentially omitting critical information that could influence patient management. This is contrary to the comprehensive nature of medical charting expected in professional practice. Professional reasoning. Professionals should employ a decision-making framework that integrates technological assistance with critical human oversight. This involves 1. Understanding the capabilities and limitations of any automated tools. 2. Actively observing the patient and the physician's interactions. 3. Cross-referencing automated data with direct observations and verbal reports. 4. Documenting any discrepancies or areas requiring further clarification from the physician. 5. Prioritizing accuracy and completeness in all documentation. This systematic approach ensures that the medical record is a reliable and comprehensive resource for patient care. Question 13. Which approach would be most professionally appropriate when a patient's family member, present during a clinical encounter, asks the medical scribe to explain complex medical terminology used by the physician? Option A. Provide a simplified explanation of the medical terms to the family member, aiming to be helpful and alleviate their immediate concerns. Option B. Politely decline the request, explaining that medical terminology interpretation is the responsibility of the physician or other licensed healthcare provider, and suggest they speak with the physician directly. Option C. Ignore the family member's request and continue with documentation duties without acknowledgement. Option D. Offer to look up the medical terms online and provide the family member with a definition from a general medical website. The correct answer is B. Politely decline the request, explaining that medical terminology interpretation is the responsibility of the physician or other licensed healthcare provider, and suggest they speak with the physician directly. Explanation. This scenario presents a professional challenge due to the inherent conflict between a scribe's duty to accurately document patient encounters and the potential for misinterpretation or misuse of medical terminology by a non-medical family member. The scribe must navigate this situation while upholding patient privacy and ensuring the integrity of the medical record. Careful judgment is required to balance the family member's desire for information with the professional and ethical obligations of the scribe. The correct approach represents best professional practice because it prioritizes the integrity of the medical record and patient privacy, aligning with the core principles of medical documentation and ethical conduct expected of certified medical scribes. By politely but firmly declining to explain the medical terms to the family member and instead directing them to the appropriate medical professional, the scribe upholds their role as a neutral observer and recorder. This action prevents potential miscommunication, avoids unauthorized disclosure of protected health information, FI, to a non-authorized individual, and ensures that any patient-related discussions occur with the physician or other licensed healthcare provider who can provide accurate and contextually appropriate information. This adheres to the spirit of the Medical Scribe Certification and Aptitude Test, MSCAT, guidelines, which emphasize accuracy, professionalism, and adherence to privacy regulations. An incorrect approach that involves explaining the medical terms to the family member represents a significant ethical and regulatory failure. This action could lead to misinterpretation of complex medical information, potentially causing undue anxiety or false reassurance to the family. Furthermore, it constitutes a breach of patient privacy and confidentiality, as the scribe is not authorized to disclose PHI to individuals not explicitly designated by the patient or legally permitted to receive such information. This directly violates the principles of HIPAA, Health Insurance Portability and Accountability Act, if in a U.S. jurisdiction, or equivalent privacy regulations in other jurisdictions, which are implicitly tested in a certification like MSCAT. Another incorrect approach, such as ignoring the family member's request entirely, is unprofessional and can create a negative patient experience. While it avoids the pitfalls of miscommunication and privacy breaches, it fails to demonstrate professional courtesy and can lead to frustration for the family, potentially impacting their perception of the healthcare team. A professional scribe should acknowledge the request and provide a polite, appropriate response, even if it's a refusal. The professional decision-making process for similar situations involves a clear understanding of one's role and limitations as a medical scribe. First, assess the request. Is it within the scribe's scope of practice? Second, consider the potential consequences of fulfilling the request. Could it lead to misinterpretation, privacy breaches, or professional misconduct? Third, prioritize ethical and regulatory obligations, patient privacy, accuracy of documentation, and professional boundaries. Finally, communicate professionally and appropriately, even when declining a request, by offering alternative authorized channels for information. Question 14. The review process indicates that a patient presents with audible crackles in the lower lung fields during auscultation. Which of the following approaches best reflects the scribe's responsibility in documenting this finding for the Medical Scribe Certification and Aptitude Test MSCAT? Option A. Document that the patient has pneumonia based on the presence of crackles. Option B. Document that the patient has abnormal breath sounds in the lower lung fields. Option C. Omit the documentation of crackles as they are a common finding. Option D. Document the presence of crackles specifying their location, e.g., bilateral bases and timing, e.g., inspiratory. The correct answer is D. Document the presence of crackles specifying their location, e.g., bilateral bases and timing, e.g., inspiratory. Explanation. Scenario analysis. This scenario presents a challenge in accurately documenting patient respiratory status, specifically the presence and characteristics of adventitious lung sounds. Misinterpreting or inaccurately documenting these findings can lead to delayed or incorrect diagnosis, inappropriate treatment plans, and potential patient harm. The scribe must possess a strong understanding of respiratory physiology and the nuances of auscultation to ensure precise and clinically relevant documentation. Correct approach analysis. The correct approach involves the scribe actively listening to the patient's breath sounds, identifying any abnormal sounds, adventitious sounds, and then accurately describing their characteristics, e.g., crackles, wheezes, ronchi, location, e.g., bilateral bases, right upper lobe, and timing, e.g., inspiratory, expiratory, continuous. This detailed and objective documentation directly supports the physician's assessment and facilitates appropriate clinical decision-making, adhering to the MSCAT emphasis on accurate medical record keeping. Incorrect approaches analysis. Failing to document adventitious lung sounds when present is a failure to capture critical clinical information. This omission can lead to a false impression of normal respiratory function, potentially delaying necessary interventions and violating the ethical obligation to provide a complete and accurate patient record. Documenting adventitious lung sounds with vague or generic terms like abnormal breath sounds lacks the specificity required for effective clinical communication. This imprecision hinders the physician's ability to understand the nature of the abnormality and can lead to misinterpretation, which is a breach of professional responsibility in medical documentation. Attributing a specific diagnosis, e.g., patient has pneumonia, based solely on the presence of adventitious lung sounds without physician confirmation is beyond the scribe's scope of practice. This constitutes an unauthorized medical opinion and a significant ethical and regulatory violation, as scribes are not licensed to diagnose. Professional reasoning. Professionals should approach documentation by first understanding the clinical context and the purpose of the information being recorded. When assessing respiratory sounds, the scribe should actively listen, identify abnormalities, and then use precise, objective language to describe these findings. If unsure about the interpretation of a sound, the scribe should seek clarification from the supervising physician rather than making assumptions or omitting information. This iterative process of observation, accurate recording, and seeking clarification ensures the integrity and clinical utility of the medical record. Question 15. The analysis reveals that a physician is documenting a progress note for a patient with a chronic condition. During the encounter, the physician notes a new, mild symptom that was briefly mentioned by the patient and then addressed with a minor adjustment to the patient's existing medication regimen. Which approach to documenting this new information in the progress note best aligns with the regulatory framework, laws, and guidelines for the medical scribe certification and aptitude test, MSCAT? Option A. Document the new symptom and the specific medication adjustment made by the physician, including the rationale if provided. Option B. Summarize the new symptom and medication adjustment as a minor change without detailing the specific symptom or the exact adjustment. Option C. Omit the new symptom from the progress note since it was only briefly mentioned and did not appear to be a major concern for the physician. Option D. Focus solely on the physician's direct verbal commands for the medication adjustment, without mentioning the new symptom that prompted it. The correct answer is A. Document the new symptom and the specific medication adjustment made by the physician, including the rationale if provided. Explanation. This scenario presents a common challenge in medical documentation, ensuring accuracy and completeness in progress notes while adhering to strict regulatory requirements. The professional challenge lies in balancing the need for timely documentation with the imperative to capture all essential clinical information accurately. Misinterpreting or omitting critical details can lead to patient safety issues, billing discrepancies, and regulatory noncompliance. Careful judgment is required to discern what constitutes a significant change or new information that necessitates specific documentation. The correct approach represents best professional practice because it prioritizes patient care and regulatory adherence by meticulously documenting all relevant changes and new findings. This aligns with the core principles of medical record keeping, which mandate that documentation be accurate, complete, and contemporaneous. Specifically, it reflects the requirements of the medical scribe certification and aptitude test (MSCAT) framework, which emphasizes the scribe's role in accurately reflecting the physician's assessment and plan. This thoroughness ensures that subsequent healthcare providers have a clear and comprehensive understanding of the patient's condition and treatment trajectory, thereby promoting continuity of care and minimizing the risk of medical errors. An incorrect approach that focuses solely on the physician's direct verbal commands without independently verifying or clarifying the context of new information is professionally unacceptable. This fails to meet the standard of accurate and complete documentation, potentially omitting crucial details that the physician may have implicitly considered or that are vital for understanding the clinical picture. This could lead to a fragmented or incomplete medical record, violating the principles of good medical practice and potentially the specific guidelines of the MSCAT, which expects scribes to be diligent in their transcription. Another incorrect approach that involves summarizing or paraphrasing significant changes without capturing the specific details of the change or the physician's rationale is also professionally unacceptable. This approach risks oversimplification and the loss of critical nuances that are essential for accurate medical interpretation and decision-making. The MSCAT framework expects a high degree of fidelity in documenting clinical encounters, and such summarization would likely fall short of this expectation, potentially leading to misinterpretations by other healthcare professionals. A further incorrect approach that involves omitting any mention of a new symptom or finding, if it was not explicitly discussed in detail by the physician, is also professionally unacceptable. Even if a symptom was briefly mentioned or observed, its inclusion in the progress note is crucial for a complete record. The absence of such information could create a misleading impression of the patient's condition and hinder effective care. The MSCAT emphasizes the scribe's responsibility to capture all pertinent clinical data, regardless of the perceived level of detail in the physician's discussion. Professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and observe all aspects of the patient encounter. Second, identify any new symptoms, findings, or changes in the patient's condition, as well as any new diagnostic or therapeutic interventions. Third, ensure that these are accurately and completely documented in the progress note, including the physician's assessment and plan related to them. Fourth, if any aspect is unclear or requires further detail, proactively seek clarification from the physician. This iterative process of listening, documenting, and clarifying is fundamental to maintaining high standards of medical record keeping and adhering to regulatory requirements. Question 16. The efficiency study reveals that a significant number of patient encounters logged by medical scribes have minor discrepancies between the documented chief complaint in the electronic health record (EHR) and the physician's verbal summary of the patient's reason for visit. These discrepancies are often subtle, such as a slight variation in wording or the omission of a minor symptom. The study suggests that these minor errors, if unaddressed, could cumulatively impact the accuracy of patient histories and potentially influence downstream data analysis. What is the most appropriate course of action for a medical scribe to take when encountering such a discrepancy? Option A. Review the original source documentation, e.g., patient intake forms, physician's initial notes, to verify the chief complaint, and if an error is confirmed, follow the established protocol for amending the EHR entry with proper documentation. Option B. Ignore the discrepancy and continue with the next patient encounter, as the study indicates these are minor issues and addressing them would significantly slow down workflow. Option C. Document the discrepancy in a separate, non-EHR communication log and proceed with the current EHR entry, as the discrepancy is minor. Option D. Immediately correct the EHR entry to perfectly match the physician's verbal summary, assuming the verbal summary is the most current and accurate representation. The correct answer is D. Immediately correct the EHR entry to perfectly match the physician's verbal summary, assuming the verbal summary is the most current and accurate representation. Explanation. This scenario presents a professional challenge because it requires a medical scribe to balance the immediate need for accurate data entry with the long-term implications of data integrity and patient privacy, all within the strict confines of the medical scribe certification and aptitude test, MSCAT, regulatory framework. The core of the challenge lies in identifying and rectifying potential data entry errors without compromising the security or confidentiality of protected health information. 5. Careful judgment is required to determine the most appropriate and compliant method for addressing discrepancies. The correct approach represents best professional practice because it prioritizes adherence to established protocols for data correction and verification. This involves a systematic review of the electronic health record (EHR) against the original source documentation, followed by a documented correction process. This method ensures that all changes are auditable, traceable, and comply with the principles of data accuracy and integrity mandated by healthcare regulations. It upholds the scribe's responsibility to maintain the fidelity of patient records. An incorrect approach that involves making assumptions or direct edits without proper verification and documentation would be a significant regulatory and ethical failure. Such actions could lead to inaccurate patient records, potentially impacting clinical decision-making and patient care. Furthermore, unauthorized or undocumented modifications to PHI can violate privacy regulations, leading to severe penalties. Another incorrect approach, such as ignoring the discrepancy due to time constraints, would be a failure of professional duty and could result in the perpetuation of errors, undermining the reliability of the EHR and potentially harming patients. Professional decision-making in such situations should involve a clear understanding of the EHR system's functionalities for error correction, a commitment to thorough verification, and strict adherence to institutional policies and regulatory guidelines. When faced with a data entry discrepancy, a scribe should first attempt to reconcile the information by reviewing the original source. If a clear error is identified, the scribe should follow the established protocol for correcting EHR entries, which typically involves a documented amendment rather than a simple overwrite. If the discrepancy cannot be resolved through direct review, the scribe should escalate the issue to a supervisor or the responsible clinician for clarification and guidance, ensuring that patient data remains accurate and compliant. Question 17. The control framework reveals that a physician is dictating a patient's physical examination findings, stating, upon palpation of the upper abdominal quadrant, the patient reports sharp, localized pain, particularly on inspiration. The medical scribe is tasked with documenting this finding, considering the anatomical structures typically located in the upper abdominal quadrants and their physiological functions. Which of the following best represents the accurate and professional documentation of this finding? Option A. Documenting the pain as originating from the right upper quadrant, potentially involving the liver or gallbladder, given their anatomical location and common pathologies presenting with such symptoms. Option B. Documenting the pain as abdominal pain without further specification, as the exact anatomical source is not definitively stated by the physician. Option C. Documenting the pain as originating from the stomach area, as this is a common patient descriptor for upper abdominal discomfort. Option D. Documenting the pain as epigastric pain, assuming it refers to the general upper central abdominal region without considering specific organ involvement. The correct answer is A. Documenting the pain as originating from the right upper quadrant, potentially involving the liver or gallbladder, given their anatomical location and common pathologies presenting with such symptoms. Explanation. This scenario presents a professional challenge due to the critical nature of accurate anatomical and physiological documentation in patient care. Misinterpreting or misrepresenting these details can lead to diagnostic errors, inappropriate treatment plans, and potentially patient harm. The medical scribe's role is to faithfully and accurately record the physician's observations and dictations, ensuring the integrity of the medical record. The correct approach represents best professional practice because it prioritizes accuracy and adherence to established medical terminology and anatomical understanding. By correctly identifying and documenting the anatomical structures involved in the patient's reported symptoms, the scribe ensures that the physician has a precise foundation for diagnosis and treatment. This aligns with the core ethical and professional responsibility of maintaining a truthful and complete medical record, which is a cornerstone of patient safety and effective healthcare delivery. An incorrect approach that involves guessing or using imprecise language is professionally unacceptable. This failure constitutes a breach of professional duty by introducing ambiguity into the medical record. Such imprecision can lead to miscommunication between healthcare providers, potentially resulting in incorrect diagnoses or treatments. Ethically, it violates the principle of beneficence, acting in the patient's best interest by compromising the quality of care. From a regulatory standpoint, inaccurate documentation can be considered a violation of standards for medical record keeping, potentially leading to scrutiny and sanctions. Another incorrect approach, such as omitting the specific anatomical detail due to uncertainty, is also professionally problematic. While it avoids introducing misinformation, it deprives the physician of potentially crucial information. This omission can hinder the diagnostic process and delay appropriate interventions. Ethically, it falls short of the scribe's duty to provide a comprehensive record, The professional decision-making process for similar situations involves a systematic approach. First, ensure a thorough understanding of the physician's dictation and the patient's reported symptoms. If there is any ambiguity regarding anatomical or physiological terms, the scribe should seek immediate clarification from the physician. The scribe must then apply their knowledge of anatomy and physiology to accurately translate the physician's intent into the medical record, using precise and universally understood medical terminology. The ultimate goal is to create a medical record that is both accurate and clinically useful, supporting optimal patient care. Question 18. During the evaluation of a patient presenting with a new complaint, the scribe notes that the patient states, "I've been feeling dizzy for the past hour," and observes that the physician documents, "Patient appears pale and diaphoretic." Which of the following accurately categorizes these pieces of information within the SOAP note framework according to MSCAT guidelines? Option A. I've been feeling dizzy for the past hour in the objective section, and patient appears pale and diaphoretic in the subjective section. Option B. I've been feeling dizzy for the past hour in the subjective section, and patient appears pale and diaphoretic in the objective section. Option C. Both, I've been feeling dizzy for the past hour, and patient appears pale and diaphoretic in the subjective section. Option D. Both, I've been feeling dizzy for the past hour, and patient appears pale and diaphoretic in the objective section. The correct answer is B. I've been feeling dizzy for the past hour in the subjective section, and patient appears pale and diaphoretic in the objective section. Explanation. This scenario is professionally challenging because it requires the scribe to accurately and ethically capture patient information within the structured SOAP note format, adhering strictly to the medical scribe certification and aptitude test, MSCAT guidelines. The core challenge lies in distinguishing between subjective patient statements and objective clinical findings, and then correctly categorizing them within the appropriate SOAP note sections. Misclassification can lead to incomplete or inaccurate patient records, potentially impacting clinical decision-making and patient care. The correct approach represents best professional practice because it demonstrates a thorough understanding of the SOAP note structure and its purpose in medical documentation. By accurately placing the patient's reported symptom of feeling dizzy in the subjective section, the scribe correctly identifies information directly from the patient's perspective. Subsequently, documenting the physician's observation of patient appearing pale and diaphoretic in the objective section accurately reflects observable clinical data. This precise categorization ensures the integrity of the medical record, providing a clear and organized representation of the patient's visit for all healthcare providers. This aligns with the MSCAT emphasis on accurate and structured documentation. An incorrect approach of placing feeling dizzy in the objective section is a regulatory and ethical failure. The objective section is reserved for observable, measurable, or verifiable data gathered by the healthcare provider. Patient's subjective feeling, by definition, cannot be directly observed or measured by the provider, and therefore does not belong in this section. This misclassification violates the fundamental principles of accurate medical record keeping, as mandated by the MSCAT, potentially leading to confusion about the source of information and misinterpretation of the patient's condition. Another incorrect approach of placing patient appearing pale and diaphoretic in the subjective section is also a significant regulatory and ethical failure. The subjective section is for information reported by the patient. The physician's observation of the patient's appearance is a direct clinical finding and is objective data. Placing this in the subjective section misrepresents the source of the information and undermines the clarity and accuracy of the medical record, which is a core requirement of the MSCAT. The professional reasoning process for similar situations involves a systematic approach to information categorization. First, identify the source of the information. Is it coming directly from the patient's subjective, or from the healthcare provider's observations, tests, or measurements objective? Second, consider the purpose of each section of the SOAP note. The subjective section captures the patient's story, while the objective section captures the clinician's findings. Third, always refer back to the specific guidelines and standards set forth by the MSCAT for medical scribing, ensuring all documentation practices are compliant. Question 19. Operational review demonstrates that during a patient encounter, the physician notes a well-demarcated erythematous papule, approximately 0.5 cm in diameter, on the dorsal aspect of the left forearm. The patient also reports experiencing mild itching and a dull ache in the area, Which of the following Scribe actions best reflects accurate and complete documentation according to MSCAT guidelines? Option A. Document erythematous papule 0, 5 cm dorsal left forearm. Patient reports itching and dull ache. Option B. Document skin rash on left arm. Option C. Document patient presence with a skin lesion on the left forearm, itchy and painful. Option D. Document physician noted a lesion. Patient complained of discomfort. The correct answer is C. Document patient presence with a skin lesion on the left forearm, itchy and painful. Explanation. The scenario presents a common challenge in medical documentation, ensuring accuracy and completeness of patient information, particularly concerning a visible and potentially symptomatic integumentary issue. The scribe's role is to accurately reflect the physician's findings and the patient's reported symptoms. Misinterpreting or omitting such details can lead to incomplete medical records, potentially impacting patient care and diagnostic pathways. The challenge lies in the scribe's responsibility to capture objective findings and subjective patient reports accurately, adhering to the established standards of medical documentation and the specific guidelines of the Medical Scribe Certification and Aptitude Test, MSCAT. The correct approach involves meticulously documenting the observed skin lesion, including its characteristics and the patient's subjective description of pain and itching. This aligns with best professional practice by ensuring the medical record is a comprehensive and accurate representation of the patient's condition. Adherence to MSCAT guidelines mandates precise and thorough documentation of all relevant clinical information, including physical examination findings and patient-reported symptoms. This detailed record allows for proper diagnosis, treatment planning, and continuity of care. An incorrect approach of simply noting skin rash without further detail fails to capture the essential characteristics of the integumentary issue. This omission is a regulatory and ethical failure because it creates an incomplete medical record, hindering the physician's ability to assess the severity and nature of the condition. It also violates MSCAT guidelines requiring detailed documentation. Another incorrect approach of omitting the patient's reported itching and pain is also a failure. These are crucial subjective symptoms that provide context for the observed lesion and can influence diagnostic considerations and treatment. Failing to document these subjective complaints is a breach of accurate medical record-keeping and MSCAT standards. Finally, an approach that documents the lesion but not the patient's specific description of its appearance, e.g., red, raised, is also deficient. The physician's assessment is informed by both objective findings and the patient's narrative, and omitting the patient's descriptive language leads to a less nuanced and potentially less accurate record. Professionals should approach such situations by actively listening to the patient's description of their symptoms, carefully observing the physician's examination, and then translating these observations and reports into clear, concise, and comprehensive documentation. This involves using precise medical terminology and capturing all relevant details, both objective and subjective, as per the established protocols and ethical obligations of medical record keeping. Question 20. Governance review demonstrates that a medical scribe tasked with documenting a patient's chief complaint encounters the term dyspepsia. To ensure accurate and compliant charting, which of the following approaches best reflects the application of medical terminology principles as expected by the Medical Scribe Certification and Aptitude Test, MSCAT framework? Option A. Focusing solely on the common understanding of dyspepsia as upset stomach, without dissecting the etymological components for precise meaning. Option B. Recognizing dys as a prefix indicating difficulty and pepsia as a root word related to digestion, thus accurately documenting the complaint as indigestion or difficulty digesting food. Option C. Assuming dys implies a severe condition and pepsia refers to a general ailment, resulting in documentation of severe digestive distress. Option D. Interpreting dys as a general negative prefix and pepsia as a term related to stomach discomfort, leading to a broad documentation of stomach pain. The correct answer is B. Recognizing dys as a prefix indicating difficulty and pepsia as a root word related to digestion, thus accurately documenting the complaint as indigestion or difficulty digesting food. Explanation. Scenario analysis. This scenario presents a challenge in maintaining accurate and compliant medical documentation, a core responsibility of a certified medical scribe. The challenge lies in correctly interpreting and applying medical terminology derived from prefixes, suffixes, and root words to accurately reflect patient conditions and procedures. Misinterpretation can lead to documentation errors, impacting patient care, billing, and regulatory compliance. The need for absolute precision in medical records, as mandated by the MSCAT framework, makes this a critical area for assessment. Correct approach analysis. The correct approach involves a thorough understanding of the etymology of medical terms. By dissecting terms like dyspnea into its components DIs, difficult/painful, PNE, breathing, the scribe can accurately document the patient's symptom as difficulty breathing. This precise application of linguistic knowledge ensures that the medical record is a faithful and unambiguous representation of the clinical encounter, aligning with the MSCAT emphasis on accurate and compliant documentation. This directly supports the integrity of patient records, which is a fundamental ethical and regulatory requirement. Incorrect approaches analysis. One incorrect approach is to rely on phonetic similarity or common usage without understanding the precise meaning of the root word or suffix. For example, mistaking dyspnea for a general term related to pain without recognizing the specific root related to breathing would lead to inaccurate documentation. This failure to dissect the term violates the MSCAT requirement for precise medical record keeping and could lead to misdiagnosis or inappropriate treatment based on flawed documentation. Another incorrect approach is to oversimplify or generalize the meaning of a prefix or suffix, leading to a loss of specificity. If a scribe understands hyper as simply high, but fails to recognize its specific application in contexts like hypertension, high blood pressure, or hyperglycemia, high blood sugar, they might inaccurately document a patient's condition. This lack of specificity undermines the detailed nature of medical charting required by regulatory standards and the MSCAT. A further incorrect approach is to assume the meaning of a term based on a single component without considering the entire word's context. For instance, recognizing itis as inflammation is crucial, but applying it without understanding the root word it modifies, e.g., appendicitis vs. arthritis, would result in incorrect documentation. This demonstrates a superficial understanding of medical terminology, which is insufficient for the rigorous standards of medical scribing and regulatory compliance. Professional reasoning. Professionals should approach medical terminology by systematically breaking down terms into their constituent parts, prefixes, root words, and suffixes. This analytical process allows for a precise understanding of the term's meaning. When encountering unfamiliar terms, scribes should consult reliable medical dictionaries or terminology resources. This methodical approach ensures accuracy, clarity, and compliance with documentation standards, fostering trust in the medical record and supporting effective patient care.